Hello, and welcome to Promising Health Center Practices to Increase Access for Migratory and Seasonal Agricultural Workers, a webinar in collaboration with the Ag Worker Access Campaign Task Force. You can go ahead and next slide. So first, I'd like to quickly review our learning objectives. By the end of this webinar, participants will be able to identify 2 promising practices implemented by health centers to improve access to care for MSAWs, describe how practices address common barriers faced by MSAWs across different service settings, and explore ways to adapt and apply these strategies within organizations and enhance service delivery for MSAW communities. Next slide. Greetings from NCFH. Thank you so much for joining us today. I really am filled with hope to be here virtually with so many people working to increase access to quality care for migratory and seasonal agricultural workers, or MSAWs, and their families. This is a short update on the Ag Worker Access Campaign. Health centers are places where promising practices are born. They currently serve approximately 20% of MSAWs in the US. We know that MSAWs and their families often lack access to even basic health care. Today, more than 60 years after the passage of the Migrant Health Act of 1962, we as health champions continue our work to ensure access to quality healthcare for MSAWs through the Ag Worker Access Campaign that began in 2015 as a national effort to increase the number of MSAWs and their families seen in health centers across the US. Next slide. So the campaign's focused on these 4 things. 1, understanding and addressing MSAW's unique needs and the challenges they face when accessing healthcare. 2, ensuring health center staff receive the highest quality training and technical assistance that they need to reach MSAWs and accurately classify and report them in the uniform data system. 3, to support the development of useful relationships between health centers and other MSAW serving entities. And 4, identify and disseminate promising practices for increasing access to quality care for MSAWs and their families. The campaign is led by a national task force that guides the direction of the campaign. The task force is comprised of representatives from health centers, primary care associations or PCAs, health center networks, national training and technical assistance partners or NTAPs, and other organizations. The task force does this important work by identifying challenges, exploring and launching innovation, formulating recommendations, supporting strategic relationship building, and by identifying and disseminating promising practices. So lastly, let's briefly cover some of the benefits of being part of the campaign. And we invite you to scan this QR code you'll see on your screen now to join, or we'll also add a link in the chat. So campaign members receive access to downloadable tools and resources to help raise awareness about the MSAW population and assist with increased access to care efforts, which are specific to the campaign. Campaign members become part of a nationwide network of organizations committed to the same goal. Campaign members have access to customized regional training opportunities through our Increased Access to Care program, a program born from the campaign itself to assist health center staff with developing a better understanding around MSAWs, including accurate identification, classification, and reporting in the UDS. Campaign members also have access to technical assistance and program action planning support to assist health centers in reaching increased access to care goals. So please join us in this important work and sign up as an organizational member of the campaign today using, again, the QR code on your screen or the link in the chat. This webinar highlights promising practices at health centers aimed at increasing access to care for MSAWs. These insights are intended to inform strategies across a variety of service settings. Up next, we'll hear from speakers who shared their work during the recent NCFH Spring Agricultural Worker Health Symposium. They will present promising practices they are implementing at their health centers. We also recognize that many of you in the audience are engaged in similarly innovative efforts. So towards the end of the presentation, we'll share our contact information, and we encourage you to reach out to us to share your strategies so we can explore ways to amplify them on a national level. Next slide, please. So without further ado, next I'd like to introduce today's speakers, Dr. Daniel Zinnel, CEO of Proteus Inc. in Iowa, who will present first, and from Great Lakes Bay Health Centers in Michigan, Jesse Costill, Migrant Program Director, and Amanda Cook, Migrant Medical Director. As I said, Dr. Zinnel will start us off. Dr. Zinnel will be speaking about his health center's approach to addressing food insecurity. So Dr. Zinnel, over to you.
Thank you so much, Joshua, and thank you to NCFH for the invitation. Good afternoon, everybody. Greetings. Hope you all are having a great week so far. I'm excited to share more about Proteus and the work we're doing around food security in our state of Iowa. A little background about Proteus. We are a multi-state nonprofit that provides services specifically to agricultural workers and their families. In addition to Iowa, we also provide services to farm workers in Nebraska and in Indiana. We were started back in 1979, and the first grant we started implementing, we still implement today. It's called the National Farmworker Jobs Program. And now we implement that contract in not only Iowa, but Nebraska and Indiana. It's a program that is really intended to help farm workers or anyone in their family get access to education assistance and really building skills around driving generational wealth and improving their overall self-sufficiency for themselves and their families. So if you are in a state outside of ours, I encourage you to connect with your state's National Farmworker Jobs Program grantee. You can find them on the Association of Farm Worker Opportunities website, afop.org. If you search their members, you can find your local partner, which is an incredible service provided to farm workers in helping them attain educational credentials and improve their skills so that they can improve their wealth. Our participants on average go from making less than 100% of poverty to, once they exit, making well over $40,000 a year. So a huge return on investment as a whole. In addition to that, across our 3 states, we also provide health and safety trainings to farm workers, where we train them on life-saving information such as heat stroke and heat stress prevention, pesticide exposure, among other things. In the past, we've done a lot around COVID-19. We will likely be doing some around measles, and are looking at some point to do probably more around smoke from the wildfires once we have a curriculum that we can use for that. On average, we train around 7,000 farm workers, where we literally go out into the fields and train them before they start working. In addition to those, we also are a community health center in the state of Iowa. And so we are a federally qualified health center, specifically a migrant health center, and we're also a voucher program. So we're quite unique in the FQHC space, where our healthcare delivery model is unique. We have 3 brick and mortar clinics that patients can access care, but most of our care is out in the fields, where we go to where the farm workers are at, set up temporary mobile clinics, either on site where they work or in the communities where they're living, in order to eliminate as many barriers to care as possible. But one of the things that we expanded 2 years ago now is our access to food program. So if you want to go to the next slide, I can talk about that. I thought it was preposterous. I've worked with Proteus twice in my career. The first stint was from 2007 to 2014, and thought it was so preposterous that our farm workers are in such close proximity to vegetables and fruits, but oftentimes don't live in communities where they have that access themselves. And so this map just shows the food deserts that we have across our entire country, and many of our farm workers live in these communities where they cannot access a local grocery store, have to travel miles upon miles in order to get the access they need for themselves and their families. Next slide. So to do this, we started a pilot program where we found a local partner. They are called Capital City Fruit. They're based in Norwalk, Iowa, which is a suburb of Des Moines, and they're a grocery shipper. They ship all across the country. So they literally ship produce to individuals' doorsteps, which we felt like was an important piece to this program. And so we found our grocery store that will ship, and then we worked on building the funds. And so um, I'm sure many of you are wondering there when we presented in Grand Rapids, there was a lot of questions on, okay, this is great, but how did you fund it? So our initial funder was actually Tito's Handmade Vodka. Their local rep nominated us for a national award through them that we went through multiple rounds and ultimately were selected to be part of their passion project is what it's called, which awarded us $50,000. And so we set up this program in support initially by Tito's Handmade Vodka in collaboration with Capital City Fruit. And the first phase was just getting the produce to farm workers. So we went through all of our patients' data. We first wanted to prioritize patients who experienced hypertension and or diabetes, and then also layered that with those that are living in food deserts. And so they were the first priority. And then we randomized and chose a number of families to receive this fresh produce. So it was delivered every other week for free for 6 months, enough to feed on average a family of four for that 2 weeks. So for 6 months for free, families got access to fresh produce to feed their families, which was really incredible. We had really positive outcomes, even just with if you want to go to the next slide, of just this first phase of just providing access to fresh produce. So you can see on average, our families that we served were well below the 100% of poverty threshold. Average family size was around four, but we saw a huge improvement in their health outcomes. So if they, on their A1Cs and on their blood pressure test results, we saw 63% of those patients improve. And many of them, it was an astronomical improvement in what their readings were before participating in the program. About 11% stayed the same, and we did see about a quarter worsen, but there wasn't anything that was of significance of those patients that worsened. It was just a slight decline in their A1C or their blood pressure rates. So having seen these positive results, we wanted to add some additional interventions. And so if you want to go to the next phase two of our pilot. And so we're still doing the 6 months biweekly delivery for free, but we're adding some additional components. And so one piece is our provider is doing monthly motivational interviewing calls with all of them. And just by just some early kind of indication of feedback we've received so far is we're learning so much more than what we had heard in their exam. And so we're able to better tailor their services and better respond to their needs more appropriately because we are offering these motivational interviewing sessions with the participants. And so we're hopeful that we'll see those outcomes improve even more. But we're also working with the University of Iowa on a formal evaluation piece to this program so that we can hopefully produce a formal document for others to then be able to replicate as a best practice going forward. Next slide. We do have a link, I believe, that will be shared in the chat. And so last year, we do an annual I'm Thankful for Farm Workers dinner. We started that about 5 years ago. It's our annual fundraising event to obviously raise funds to support important programs like this that aren't always supported by federal funds or grants. But we also really focus on the farm workers. And so we do 2 Farm Worker of the Year awards at this event, but then we also do a supporter or partner of the year award. And so last year we honored Tito's Handmade Vodka and Capital City Fruit. And so I encourage you to check out that link and learn more about the program. And I'm also always happy to connect with anyone that is interested in learning more or wants some help or guidance on how to initiate this type of program within your community health center. And while I have just another minute or so, we are in a current campaign separate from food, which is all about water for farm workers. So this Monday, June 23rd, was National Hydration Day. And for the past few years, we've done a fundraising campaign around raising funds to purchase hydro flasks in order to distribute out to farm workers, knowing that many of them don't have access to cold water throughout the day. And so we honored a local business who was able to get us Hydro Flask a couple years ago. If you want to look at our YouTube page further, you'll see that video. But would encourage you all to consider doing that type of campaign as well in order to get Hydro Flask or some sort of bottle to farm workers so that they can keep their water cool throughout the day. One final thing, we launched a field program. We call it FYLD Field, Farm Worker Youth Leadership Development Program. That's another thing that I'll be sharing more about in the future, just to get you maybe excited before next year's symposia that maybe I'll be presenting more on in the future. But thank you, Joshua, and thank you, NCFH, for allowing me to talk more about our food security program.
Thank you so much, Daniel. We really appreciate you sharing your time and expertise. Thank you. Encourage everyone to follow up and on all of that information shared. Next up, we have Jesse Costill, Migrant Services Director, and Amanda Cook, the Migrant Services Medical Director of Great Lakes Bay Health Centers. Jesse and Amanda, over to you.
Thank you. It's good to see you guys again. We were asked if we would be willing to share some of our promising practices from Great Lakes Bay Health Centers. And it took us a little bit to kind of come up with what would be a good one to share. But when we landed on this, I was saying, yeah, that's absolutely right. Because to me, this practice that has kind of developed with our program has been absolutely critical to the way that we run and the way that we've had success. So I'm Amanda Cook. I'm our migrant medical director for our mobile program, and Jesse is here online with the hat. He's our migrant services director. Vanessa, if you could go to the next slide. We wanted to talk about how important it is to build a solid relationship with executive team and board as far as leadership, and how important that has been in the development of our program. So kind of an investment in return and engaging that senior leadership. The first point that I had brought up was establishing that the care of migratory and seasonal agricultural workers is fundamental to your organization at both an executive and a board level. And for our program, this was actually one of the easiest parts of the process because our company was founded with the express purpose of providing care for migratory and seasonal agricultural workers. But that was several decades ago, and we've evolved significantly over time. So our company is now the largest federally qualified health center in Michigan and provides care in a wide range of communities. So for us, it's been important to remind or educate our new board and executive team members of our history, as well as showing how our program is an essential part of our company's mission and vision to provide quality healthcare for everyone. I would think most organizations that are providing targeted services to migratory and seasonal agricultural workers are not for profit. So a lot of times that means there was a vision or a passion that kind of ignited the organization and is usually still there, even if it might be a little bit clouded by details of finance and human resources and all of that now. But as part of a good practice for developing or maintaining a program, discovering and aligning with your company's vision helps make it feel like everyone's working toward a common goal and purpose, not against each other. And that actually makes it a lot easier to talk with and promote the program kind of at the highest levels of the organization, saying, hey, we share these values. This is what our program wants to do, and this is how it promotes the values of the organization. Jesse, did you have anything that you wanted to add on that point?
Oh, great points. No, we can easily get discouraged and go elsewhere when you forget where you came from. But you always got to put that little reminder and definitely keep on the same mission and progress. So well said. No, go ahead.
Okay. So then the second point that I had kind of put together here is that buy-in from the leadership, the board and the executive team allows for mutual understanding and support. So taking those shared values and then turning them into shared vision and practice. Now, this is to me, this is sometimes where things can get a little more tricky, but it becomes even more important to have really clear communication. So support from an organization's leadership is obviously critical to starting and maintaining a successful program. But it allows for the program to also be flexible and to customize the care to both the needs of the community and the resources of the company, and to try new approaches. When a new approach is not successful, that role of communication and being able to communicate back to leadership why it wasn't successful makes it less likely that it will be assumed the program is a waste of resources. But on the other hand, if there's clear communication from the leadership of impending organizational challenges or changes in a setting of mutually shared goals, that can give confidence to the program management that the leadership really is working for the best interests of both the company and the program. One thing that you only need to work with people a little bit to understand is that it's not easy to understand why someone else is making the decisions that they do without very clear communication. So there can be a misunderstanding of why decisions are being made by either the program management or by the company leadership if there's not a really clear communication back and forth on why decisions are being made. So being able to discuss ideas and their potential implications is another reason why program management and leadership really need each other's insight. And then additionally with that, it's really important that when the program experiences success, that success is shared with the leadership of the organization. The leadership of the organization needs to know that there is a return on their investments of resources. So when the program and the company's aligned values are successful, the board and executive team needs to know so that those successes can be measured and celebrated and continued in practice. Jesse, we had talked a little bit about that. Did you have anything you wanted to add there?
Yeah, really good point. I mean, it's not easy, it's somebody else making decisions, but you always got to keep that open-minded, because if something doesn't work out, there's other folks that you're missing ideas from your executive team, keeping that constant communication. All right, you tried medical office and it's not working out, the population's not there anymore, the need's not there. You know what? We heard it this year for the best from the board of directors, my superiors. Jesse, let's try something else. Don't give up on it so quick. Bring in that, always keep that open mind. Bring in new ideas from your executives. Let's try dental services. Let's try optical services. So don't give up too easy on it. Yeah, it's easily and just be discouraged and, oh, it didn't work out. Let's close doors here. Well, no, look at other venues. That's why there's the existence of those executives, your board of directors. They can support you on those ideas. Just a matter of keeping that communication. And our perspective is going to be our direct supervisor, which is Mr. Jamie Furbish as well. But yeah, it's the constant communication that you gotta stay open and you gotta be persistent. Don't give up. It's easy, like I said, and days like these really hot. Is it really worth it being out here? Come on, let's give up on it. But no, you gotta. Nothing was built from last night till today. You gotta stay persistent, and more than anything, just like Daniel was expressing, the key point indicators, showing to your board, showing to your supervisors, executives, this is what we're being measured. Out of 1,500 patients, we found 80 diabetics that never knew what diabetes was. More than anything, giving them those numbers and details of what you educated for folks on as well is very, very important for any kind of growth and future of migrant services.
Yeah, thank you, Jesse. Vanessa, if you could go to our next slide. The next piece that we had looked at is how can this practically happen? How it's great to talk about it theoretically, right? And it sounds good, but then how do you practically make that happen? So I had a little bit of an advantage because I feel like I am the medical director, so I have a specific part, and Jesse's kind of the director of the overall services. So I felt like I was a little bit of I had a bit of a bird's nest view and was able to analyze kind of what had happened a little bit. And these were some of the steps that I saw engaged by our program leadership and our executive leadership that I really appreciated. The first is being well known. So whether that is I mean, you want people to know your face and your voice, or at least your hat. Like Jesse's the dude with the hat, and everybody knows that, and he's just very well known. And that works in your favor, to be well known by organizational leadership. Being aware and articulate and persistent. So Jesse had already talked about not giving up, like maybe this week doesn't work, maybe this month's board meeting doesn't work, but kind of keep being persistent, and then being articulate about what you want, what you need, and how you see that contributing to the organization overall. Another thing that I have seen that has worked really well is making regular and engaging appearances and reports to like board and senior leadership. Jesse meets annually, at least with our board. He always has a PowerPoint presentation that has pictures, that has statistics, and then he comes with this engaging personality and stories and lots of excitement, and that's very rewarding. People want to be a part of that. And want to be a part of something that is successful. Jesse, do you want to speak to that?
Yeah, no, definitely keep your board as close as you can to you. If they would give me the opportunity to present monthly, I would do it to let them know exactly what we see every month. It's awesome. It's a great connection that we have and friendship that we have with our board. I'm glad they're able to listen to us and let us explain to them. For example, before the season starts, Jesse, what's your plans for this year? Hey, we're going to go out there, try our best. Um, our executive, we had some decisions earlier this year. For example, they said, Jesse, don't be so chismoso, so gossip, and try to help people like 3 hours away from you. Focus on your area of responsibilities. And at first, I took it like, man, they're chopping my wings off. I want to go out there and help people. But no. You know what? There's a reason behind it. That's why I say that transparency. Talk to them. Let them know your ideas. If you can express that to your board, your executives will listen to you and let you know, okay, what are you going to do making that difference driving 3 hours when you have folks in your area that they haven't been served? So from that perspective, my supervisor says, Jesse, let's identify all workers in here, all agricultural workers, dairy farms. There's some areas that we haven't found out. And it was good. At first, again, I took it as a bet. I was like, okay, they're cutting my wings. But no, they actually gave me more power. You know what? Go invade for each corner of each county that we're at and give them power to that idea. Like Amanda said, they know you by the hand already. They're calling you. You branded that. It's like any other business. You got to make sure you got to express yourself out there and put that brand it and express it and show it, like let it grow like wildfire, they say. But listening more than anything, keep it always open-minded. Don't take it the bad way. If they hold you back, there's a reason behind it. So never take it back and do the best of what they leave you back with, and it just blooms from there. But no, thanks, Amanda. Go ahead.
Yeah, absolutely. Well, that actually goes right into the next point of that, maintaining open communication in both directions. Um, a practice that I have seen implemented that has been very beneficial is regular meetings between the executive team and the program management. So Jesse and Jamie have a meeting every week and kind of keep each other informed of what's happening, what changes are we seeing, how are we moving with as far as progress goes. And I think that has established a relationship between the two of them, and this reliability. Like, I can rely on Jesse telling me what's going to happen. I can rely on Jamie giving me information and explaining the reasons for the decisions that we're making. And I think that's been really important to our team. That's been very helpful. Again, talking about the early notification of things are changing. For example, if we're seeing a change in the population, as program managers, we can bring that. Hey, we're seeing that people have less transportation access. Are there ways that we might be able to handle this? So that is helpful as far as being able to start thinking in advance. How can we address some of these changes? Or coming from executive team, there may be a change in budget this year. You might want to start looking at how you can adapt the program. And then the informal evaluation and troubleshooting. So before an entire policy is implemented, it's good to be able to talk through things with the people who it may be affecting. Is there going to be a problem with this? Is there a side or an angle that I'm not able to see? Jesse, anything else you wanted to add with that?
Right on that. I mean, regular meetings are definitely important with your executives. As we know, within the board and your managers, there's a change. So updating it and making them aware of your changes, of what you're going to be implementing, definitely makes a huge difference. Um, Not everybody takes it well, meeting every week after week, but yet having that open communication and keeping them constantly aware will later in the year or the season will support you of your ideas. At first, I used to think, why do I got to meet with my chief operating officer every week? Well, I said it's impossible for me to give them everything I have with of my 20 years, of my 20 years into every week. It's impossible. But no, just little by little things that can fill them in, and where you're going with your vision will definitely support you. This is why we have events, Jamie, because we need to build that trust with folks. To have those events, you're gonna need that support. So there's always a reason behind everything. So being patient more than anything has educated me to for the long stream of future of migrant services, for sure. Thank you. Go ahead, Amanda.
Okay. Yeah, and we've kind of mentioned this at various points throughout the presentation, but be inviting and personally excited or motivated. It's really easy to see when this just kind of comes out of your heart. And if that's where it's coming from, that's actually really easy to see, and it's difficult to say no to when somebody else is very excited about something and has that passion for it. So being personally motivated, being personally excited. You don't have to always be the super outgoing person or have that super outgoing personality, but even some of us who are a little bit quieter, it just shows when that's just kind of coming from the inside. And so that when people want to get on board with that, when there's that energy that they can engage with. Um, I think we have Jamie, did you actually want to add anything? Because I would really be glad to hear from you, kind of what brought you to, I know you're newer with Great Lakes, and so you kind of learned some of that history, and a lot of this is stuff that we have learned with you. So if you want to just add some input here, I'd appreciate that. What made you engage so much? How did you feel this was important?
Yeah, happy to add a little bit of insight here. You guys have done an awesome job, and just like my welcome to the team, I'm really able to follow your energy and be inspired by the passion that the two of you bring to the service that we provide. Being a new executive at the FQHC here with Great Lakes Bay Health Centers, one of the things that I took some intentional time to do was to learn, and to just be a sponge and just try to understand how I can best support each of the areas that I'm responsible for and responsible to. And this team here has honestly been one of the most exciting areas that I've been able to learn about and be engaged in. So in the same way that the team works to establish trusting relationships with our migrant and seasonal ag workers, I wanted to do the same thing to establish a relationship with them and to learn, how can I serve them? How can I give them the things that they need, the support that they need, whether it be resources, whether it be just removal of obstacles, so that they can be the best at providing the care that they're so passionate about providing. So from an executive standpoint, it's for me, it's how can I connect to the mission and the vision that our team has, knowing that it's an extension of our organization's mission. It's an extension of why we do what we do and where we came from, and how can I best support that as an executive from my perspective, and get them the resources that they need to be able to provide the care that they're so passionate about delivering. So as an exec, I've been fortunate to be able to attend the Ag Symposium recently, where I met many of the folks that are on this call. And I think it's important for executive leadership, senior leadership, board members to be present for a couple of reasons. One, simply to show support and alignment. I think that physical presence and just that establishment of relations can really give a team the confidence that that they have a strong foundation that they're walking on, that people know what they do, they see them, they're present, they're able to hear the highlights as well as the challenges, sometimes firsthand, and that can I find give teams quite a bit of confidence that they're not out there on their own, and so I think that that's a key. The other part is timeliness of feedback, and I think that Amanda covered that really well. Regular contact and regular face-to-face time can allow for there to be a decrease in the lag of information and feedback. So if there's some new thing that's happening with the team, with the department, maybe something that they're trying to solve, and there's something that I can help with, I want that to be, a week at the most that they're waiting for that information. And then traveling to and seeing the sites, being with the team, knowing the equipment, knowing the vehicles, knowing the center, knowing the physical spaces that the team is working in, and seeing those things myself. I think that it's incredibly important for senior leadership to be able to walk in the shoes of the team that's out there putting in countless hours of travel time and in the heat, in the cold, in the rain, to be able to provide the services that are so desperately needed. So I'm blessed that I get to do it, and very excited to be the executive responsible here at Great Lakes Bay Health Centers for our migrant care team.
That is exactly one of the reasons that our program is successful. JB, thank you. A million thanks. You really do a solid service. So
Happy to.
yeah, and then Vanessa, if you want to just go at this, I believe this is our last slide. It has some contact information for our program, and that pretty well wraps up our portion of the presentation. Josh, I'll turn it back over to you.
Thank you so much, Amanda. Thank you, Jesse. Thank you, Jamie. The way you model that support of each other's work is so wonderful, and I admire that work very much. As you'll see, there's a QR code on your screen, and again, we want to encourage you to join the Ag Worker Access Campaign. As we mentioned, we're all about uplifting promising practices, and so scanning this code will allow you to connect to that campaign. And again, we want to uplift promising practices like the ones you've just heard about, but also ones that you may be working with in your health centers across the U.S. So please get in touch, take a moment, scan this, and also feel free to reach out directly. There's a link in the chat as well that you can use to fill out that quick form to join the Ag Worker Access Campaign. This has been so rich. We really appreciate your time, Daniel from Proteus Inc., Jamie, Amanda, and Jesse from Great Lakes Bay Health Centers. And we look forward to more opportunities to interact. As we mentioned, we wanted to share our contact information. Training at NCFH is that contact. Training at ncfh.org. That's the best contact for the National Center for Farmworker Health. It's also in the chat if you'd like to copy that. So for those of you joining us live, we'd love to ask you to stay on the call for a Q&A. We hope you have questions. For those of you listening to this recording, this concludes our content for today. Thank you for your time and attention.